Good day, everyone. My name is Ayesha Sarah Yumanungal.
And I am Glyza F. Colmo.
We are from BSN1 Nightingale. So for today's demonstration, we are going to perform a
Tipid sponge bath and bed shampoo.
So without further ado, let's get started. What is TSB or the tepid sponge bath? So this involves using a moist cloth or sponge damped with tepid water. So remember, we have two types of tepid water. We have the warm and the cold. So if we are talking about the standard tepid water, it's often described as a mix of cold and boiling water. So it aims for around 40 degrees Celsius. However, if the goal is to reduce a fever, the water should be cooler in the range of 24 to 33 degrees Celsius. And if we're ready to demonstrate, let's go. First, prepare all the required equipment. Hello, ma'am. May I come in?
Yes.
Close the door or curtains to provide patients privacy. Once again, good morning, ma'am. I am Ayesha Sarah Manungal, your nurse for today. So, ma'am, may I know your name first?
Glyza Colmo.
And your birthday?
December 25, 2005.
May I verify it? Can I check it on your wristband? Okay. So, ma'am, I'm here to perform a TSB, the Tipid Sponge Bath, because according to doctor's order, kailangan po natin yung gawin. So, first, ma'am, nag-hand hygiene na po ako, but to make sure, I'll perform hand hygiene again using alcohol. So, ma'am, kumusta pong pakiramdam natin ngayon? Maayos po ba?
Okay lang.
So, ma'am, let me check your temperature first. And it will just be a few minutes. Oh. So, ma'am, you have a high fever po. That means we should do a TSB para po bumaba po ang lagnat niyo. So, ma'am, papalitan ko po ang blanket natin, ha? Ma'am, tatagalin ko na po yung lab gown. Dump the washcloths into the tepid water, grasp and squeeze it but not too much to avoid water dripping. So first, ang lalagyan po natin is yung forehead ng patient. Hindi siya pang tulog, diba? And next, yung dalawang armpit niya, which is the auxiliary. Make sure to squeeze it for avoid dripping. But not too much. Do it on the other side. Periodically check patients for shivering, which indicates the water is too cold. And then, if it's not, continue for 25 to 35 minutes. Next, I'm going to place the cloth to the patient's chest. And also to the patient's each side of groin. Next, placing the waterproof pad to protect bed linens and mattress from getting wet during the sponging procedure. Now, next what I'm going to do is to sponge the patient. Pat gently the patient's face down to its neck. Sponge the patient's upper and lower limbs, which is her arms or legs, and do it for about 3 to 5 minutes. So ma'am, patagilid po ikaw ulit. Isa, dalawa, tatlo. Sponge also the patient's back and buttocks. Sponge these large areas for about 10 to 15 minutes. Check the temperature 30 minutes after completing the bath to evaluate its final effectiveness. And don't forget to document it. Inform the patient to their conditions and done.
Good day, I am Glyza Colmo, and today I am going to perform bed shampoo. So before we start, I am going to make sure to provide patient's privacy, and I am going to introduce myself to the patient and also explain the procedure to the patient. So I am going to assist you in shampooing your hair. Is that okay, ma'am?
Yes.
So may I know your name?
I am Ayesha Syra Manunggal.
When is your birthday, ma'am?
September 17, 2007.
May I see in your book, please? Okay. I am going to get the equipment that we need, ma'am, so we can perform the shampoo your hair. So, maglagay ako ng water pad sa ilalim ng shoulder mo, ma'am. Para hindi mabasa yung unan. Maglagay din ako ng towel sa chest niyo po. Maglagay ako ng cotton ball sa ears mo po. Okay lang?
Opo.
Para hindi po magpasok yung tubig sa loob ng tainga nyo. Next is, check ko po yung scalp nyo, ma'am, at saka yung hair.
So, ma'am, maglalagay po ako ng face towel sa mata nyo.
Sain ko na po yung buhok nyo, ma'am. The next, ma'am, is mag-shampoo na po tayo ng hair.
Lather the hair starts with hairline, neck, and massage the scalp. Now rinse the shampoo with tepid water. Use a dry towel to dry the hair. Optionally, you can use a hair blower to dry the hair, but you can also air dry it. Comb the hair to untangle it and also to remove some loose strands.
So, ma'am, comfortable ka ba sa posisyon mo? O, yun lang po, ma'am. Alis na po ako.